Ghana faces a significant shortage of surgical specialists, with only 6 specialists available to cater for 100,000 patients, a ratio which is far below the recommended figure of 20. Also, only 20% of district hospitals are equipped to carry out essential surgical procedures. Speaking to this grim reality, Vice Chair of the committee, Professor Ifwa Hesse, highlighted initiatives aimed at improving access to safe surgical care.
The baseline, as we estimated, we have currently only 6 SOTA physicians per 100,000 population. And we need to get to 12 by year 5. We estimate that the proportion of patients who just can travel within 2 hours to a facility is just 30. We are aiming at getting to 80 by year 5. We are looking at proportion of death and hoping to reduce it from 0.65 to 0.1. We're looking at the number of surgical procedures performed in one operating theater per 100,000 of population per year. And we're hoping to increase it from 869 to 3,000.
Professor Hesse indicated that about $500 million will be required for the successful implementation of the plan.
Well, we estimate the whole cost is going to be about $500 million US. But it's not as if we're having to start from scratch. There's already a lot of work going on in terms of the various policies that the Ministry of Health already has for healthcare. But the importance is to bring in the surgical aspect, which is lacking, which is not as strong as it could be, into those plans. So that is what we'll be looking at doing. So we may not need all of it. Some of it is already in the system, and we may have to look for other sources of funding.
Health Minister Kwabena Mensah Kando reaffirmed government's commitment to improving healthcare. He disclosed that government will, in the coming months, approve the proposal for a 20% salary increment for health workers who accept postings to rural communities.
It is our determination that we are going to roll out certain incentive packages. For example, we are going to look at increasing the salaries of people who accept posting to underserved communities by 20% of their basic salary. So that is something we are determined to do. Very soon we'll start the discussion around.
The committee will focus on 6 key areas: improving infrastructure, service delivery, workforce development, financial sustainability, information management and research, as well as leadership and management. Reporting for Joy News, Collins Frimpong.